So today I present a video about baldness, hair loss, and prostate swelling in older men. So it's again so common problem and so bad consequences. Okay, so let's go. As always, I recommend you to download the presentation as PDF file from the link in the description. Then you will get access to the source information and to the links, and then you can make your own research. Okay, let's go. And I would say the situation in this area with mainstream medicine is completely disaster. So they don't understand what it is, they don't understand what to do, and again, all the explanation is wrong in my opinion, but okay, I am not a medical professional, I am a scientist with PhD in physics and mathematics, but at least I can think logically. Let's go. So mainstream understanding of male pattern baldness and benign prostatic hyperplasia, it is a swelling of the prostate gland, pardon. Hair loss or prostate enlargement, benign prostatic hyperplasia or BPH are common conditions in aging men. Mainstream medicine links both to the hormone dihydrotestosterone, DHT. This understanding originated from observations that castration in adulthood halts the progression of the baldness and can shrink an enlarged prostate. The biological mechanism involves the enzyme P-alpha reductase, which converts testosterone to this dihydrotestosterone, a much more potent androgen. Okay, so what is happening with castrates? They indeed they indeed getting thicker skin, and hair is growing better, and they don't have prostate gland problem. Okay, nearly 10% of daily testosterone production is converted to DHT in tissues like prostate, skin, and hair follicles. Consequently, pharmaceutical treatments like finasteride, a P-alpha reductase inhibitor, are used to systemically lower levels of DHT. A daily 1 milligram oral dose of finasteride can reduce DHT by 64–68%, so it can cause side effects as sexual dysfunction and changes in the body composition. This is complete disaster, I believe. So it is like chemical castration, and then, yeah, you know that President Trump has this problem, and he is losing hair, and he decided to use this finasteride. So, I mean, medical professionals recommend him to do it, and he looks terrible, terrible. He is like castrated, yeah, person. Okay, let's go. Pardon. So challenges to the mainstream DHT-centric view. Despite the established practice of prescribing finasteride to reduce symptoms of baldness and BPH, so enlarged prostate, there are several clinical observations that challenge this model. In particular, the incidence of baldness and enlarged prostate increases with age, sure. Even so, overall DHT levels in older men decline quite substantially. So baldness is localized in specific areas of the scalp, while other androgen-sensitive hair, like facial and body hair, continues to grow, even increase and grow in thickness. Topically applied finasteride, while well absorbed, has shown no significant effect on hair regrowth, suggesting the systemic DHT model is wrong. Okay, so again, it is absolutely not logical what they are doing, but you see, free testosterone, DHT, also is dropping, quite considerably dropping. To the age of 70, it drops 2 times compared to the young adults. But meanwhile, prostate gland is increasing in size like more than twice. So then it is all problems that appear with in older men. It's with erection and with urination. So an alternative perspective, the role of tissue aging hypoxia in senescence. Okay, this what my model, my explanation, and of course it is not coherent with mainstream explanation, but at least some people also talking about this. An alternative explanation posits that baldness and enlarged prostate are manifestation of broader aging process in specific tissues, primarily driven by compromised blood flow, chronic hypoxia, cellular senescence, and fibrosis. In particular, about scalp and baldness. With age, the scalp skin undergoes thinning and stiffening. Autopsy studies suggest that calcification of capillaries may reduce blood flow, leading to chronic hypoxia, so not low oxygen in balding areas. In fact, balding areas have 40% lower oxygen levels than in non-balding areas, in non-balding sites. Okay, what is happening? You know, it is in process of the aging. The tissues are moving from normoxia to normal content of oxygen to chronic hypoxia, and chronic hypoxia starts remodeling of the tissues. In particular, in the scalp is getting stiffer, and then this hair follicle cannot go deeper and cannot get enough of nutrients and oxygen from the blood vessels. So this is why they are actually dying out. So, and also, as I said, calcium oxalate crystals, it's from eating vegetables. They deposit in capillaries and they restrict the blood flow, but also stiffening of the capillaries also contributes to the chronic hypoxia. So the hypoxia, inflammation, fibrosis cascade, it is again my understanding. Under chronic hypoxia, cells can become senescent. The senescent cells remain metabolically active and secrete a cocktail of inflammatory molecules known as senescent-associated secretory phenotype. And this SASP promotes tissue inflammation, which in turn activates fibroblasts and myofibroblasts to produce excess collagen, leading to fibrosis. This fibrosis restricts hair follicle growth depth, causing miniaturization and eventual hair loss. Studies confirm that thinning hair follicles are often surrounded by significant inflammation and fibrosis. So it is quite indication that mainstream explanation is wrong. So this again, what is happening? This stiffening and fibrosis is quite normal in injury. So it is mechanism how the wounding is healing, but it is related to hypoxia, and it also related to aging. So you can go in more details in it. So next, prostate and BHP. So and similar process occurs in aging prostate, where the accumulation of senescent fibroblasts, mostly senescent fibroblasts are getting senescent, and inflammation related to high level of this SASP lead to swelling of the prostate gland, and can promote prostate cancer development. Okay, so you see, it's all related to this inflammation. The senescent cells are larger than normal and contribute to tissue dysfunction and enlargement. So they are about 3 times larger in size. So in volume it is more than 10 times larger, and they also produce inflammation and swelling of the gland. They exhibit suppressed internal self-cleaning, so autophagy, and inefficient energy production. So you see that the difference between the senescent cells and normal cells are here presented. So it is senescent cells, they have irregular size, the increased lysosome amount and size, and by mitochondrial damaged mitochondrial accumulation, enlarged reticulum, and increased size. Okay. So you see, and this contributes to prostate, enlarged prostate. Okay, so yeah. Okay, the emerging therapeutic strategies targeting senescence. So again, if senescent cells are involved, then it is obviously we can do something about this. So a growing body of evidence suggests that the progression of the enlarged prostate and baldness may be broadly explained by age-related tissue changes, hypoxia, and accumulation of senescent cells. And you can go to the source information. Again, it is not mainstream explanation, but yet it is corresponds to observations. From this viewpoint, interventions that target senescent cells or reduce oxidative stress could be beneficial for both hair loss and enlarged prostate. Two approaches proposed. So it is, again, you can see that you can use senolytics. This is combination, for example, of doxycycline with vitamin C. It works. There were no clinical trials, but I used it myself. Yeah, it works, but you have to be very careful about this because it is not, this senolytic, they damage not only senescent cells, but other hyperactive cells, including your liver, and heart and kidney. Little bit safer, the using of xenomorphic. Xenomorphic suppress the release of damaging these pro-inflammatory factors from senescent cells. For instance, natural flavonoids, apigenin and chimeferol inhibit SASP. So yeah, well. Flavanols is normally suppressing SAP. So again, what is happening, there are the normal cells in conditions of chronic hypoxia, they get transitioned to the senescent cells, and senescent cells they produce these pro-inflammatory markers. And then what we can do, we can use senolytics. For example, fisetin is relatively safe compared to doxycycline and vitamin C combination, or xenomorphic, which just suppress activity of these senescent cells. Okay, so what topical treatment for hair loss proposed? Actually, it works. It works. So FDA-approved topical treatment include minoxidil. Minoxidil, original and oral blood pressure medication. Minoxidil promotes hair growth primarily through vasodilation, so increased blood flow, and by altering the hair growth cycle. This is, again, it works. So formulation, this minoxidil is available in solution and form. A typical solvent is polypropylene glycol, but other formulation use blends of ethanol, glycerin, and lactic acid to improve delivery and minimize skin irritation. So you can try to buy and use it. I didn't use it, but okay, but at least there are clinical studies that show that its effectiveness is in concentration and formulation. But problem that that a long-term use of minoxidil is actually not efficient. In principle, when it is only a few months or a year, it works. But after a year, if you use it regular, it stops to work. But okay, but at least it is better than nothing, and so it is improving number of hairs, density in the scalp, and also thickness. Side effects, topical use of minoxidil can cause local skin irritation and dryness. Rarely systemic side effects like heart palpitations, swelling, and dizziness may occur. So this you see. Minoxidil is available in pills, but also in solutions and also in cream lotions. So microneedling, another approved procedure. It is a cosmetic procedure that creates controlled micro-injuries in the scalp using fine needles with lengths from 0.5 millimeter to 3 millimeter. It is believed to stimulate hair regrowth by activating stem cells in the hair follicle bulge region, increasing the local blood flow and enhancing the proliferation of dermal papillae cells. Yeah, it works. It improves blood flow actually. While evidence for microneedling alone is mixed, its primary benefit is as enhancer for topical treatment. The goal is to reach just above the hair follicle bulge region, and depth 1.2 millimeters is more effective than 0.6 millimeters, while very shallow depths like a quarter of millimeter, show no benefit. Optimal length may vary with age and stage of baldness, and the bulge of the hair follicle becomes shallower over time. So it's the thickness of the skin is reduced due to fibrosis. So weekly or bi-weekly sessions are recommended. So it is again, you can buy this roller with microneedle, or there is some devices more complicated, more expensive, and you can use it twice a week, for example, and in combination with other topical treatments can work. So the synergistic effect of microneedling plus minoxidil was investigated, and it is again combining microneedling with topical minoxidil is significantly more effective than minoxidil alone, because it improves delivery of the minoxidil to the hair bulge. A key 12-week study using 1.5 millimeter needles weekly with twice daily application of minoxidil showed a dramatic difference. So hair density increased, so it is quite good. Yeah, 5 times more than minoxidil alone. And patent improvement, 82% of the patents reported improvement, compared to 4.5% in the minoxidil only group. So you see, it is really work much better. But safety, to prevent systemic absorption and irritation, patients are advised to avoid applying minoxidil on the day of the procedure, resuming 24 hours later. The procedure must be performed under sterile conditions to avoid infection, scarring, and further hair loss. Both minoxidil and microneedling show limited efficacy for non-severe alopecia areata in women, for example, but it is suited for men, for androgenic alopecia. So, number 4, emerging and supporting topical compounds. This is what I am just trying to present, to tell about this. It is not very common, but it also should work. A variety of other topical compounds show promise for improving scalp health and hair growth by influencing cellular signaling, protecting against damage, and stimulating regeneration of hair. So lactic acid, beyond being a metabolic byproduct, lactic acid acts as a signal molecule that can stimulate angiogenesis. It is signaling about hypoxia. So then reaction of the body is improve to grow new blood vessels. Approved topically, it provides mild exfoliation and hydration of skin. Topical lactic acid, about 12 to 15%, is well-established exfoliant for skin rejuvenation. It can be used less, maybe 5–10%. Emerging evidence suggests that 15% lactic acid topical application increase hair density thickness by improving the hair follicle environment. So it improves skin health, and then it works also for hair growth. And it is cheap and easy and okay, but be careful about concentration. Not 80%, but maybe again 5, 10, maybe maximum 15%. Next, amino acids. Impaired angiogenesis is linked to age-related hair loss. Certain amino acids including glutamine, glutamate, asparagine, serine, and glycine, sorry if I pronounce not well, so can promote angiogenesis. Topical application of sodium glutamate, for example, has been shown to stimulate blood vessel growth, improve blood circulation in skin, and increase hair growth in dose-dependent manner. So it is again, I use it myself, maybe I have to wait more, but I think it works. It makes hair a little bit thicker and even color restore it little bit, not completely, but my white hair getting natural color a little bit. Okay, so Glutamine is essential for vascular expansion, endothelium cells proliferation, and metabolism. But mind that glutamine appears as a reaction after reaction of glutamate, glutamic acid, with ammonia. So it's again you can use glutamate, and the glutamic acid or glutamate works again perfect, at least for mice. 2 weeks application, topical application of this sodium glutamate increased hair growth very much. So you see, 10% concentration of the glutamic acid, and it's cheap. It is you take monosodium glutamate and dissolve in water, add some other components like lactic acid, and you try it. So common and essential oils. Certain oils are used topically to stimulate hair growth by improving local blood circulation and providing anti-inflammatory benefits. Peppermint, rosemary, lavender, clove, and jojoba oils are frequently used for this purpose. Certain compounds in cloves, in particular eugenol, may have circulation boosting and anti-inflammatory properties. By improving blood circulation, clove oil at about 5% concentration might help to stimulate hair follicles, create a healthy scalp environment, and promote hair growth. Castor oil, so you can combine it with castor oil or dissolve castor oil, this clove oil in castor oil. I tried it. Yeah, it's good. It works easy to dissolve. And castor oil is rich in this omega-9 fatty acid with anti-inflammatory, antibacterial properties. So you don't drink castor oil. I mean, you apply topically. Furthermore, research indicates that metabolites of omega-3 fatty acid can improve hair follicle regeneration, and suggesting a potential synergistic effect when it is combined with blood circulation boosting oil. So you can combine, as I said, with castor oil and with other oils like this omega-3 fatty acids. Okay, whatever. But it works. Castor oil in combination with 5% of the castor oil, the cloves oil work. Cloves oil is relatively inexpensive, easy to buy. So melatonin is a hormone, but also it is antioxidant. Melatonin is a powerful lipophilic antioxidant that can easily penetrate cell membranes to protect against damage. It directly scavenges various free radicals and also enhances the activity of other antioxidative enzymes. It makes it effective at protecting skin cells and collagen from oxidative stress, such as that caused by ultraviolet radiation. The topical application of melatonin can also be used to treat alopecia, so it is already well known. Topical application of 0.1% melatonin solution has been studied for treating early stage hair loss. Results indicate that significant reduction in hair loss, improvement in seborrhea, and new hair growth in some individuals after 1 month or 3 months daily use. Applied melatonin can accumulate in tissues in the outer layer of skin, and acting as a depot for providing that release into the tissue. So it is it's quite good. So topical application again, it shows good promise both for female alopecia but also men alopecia. So, and problem that I was buying melatonin in China, and now it is I cannot buy. They provide, but it is all fake. It is not a real melatonin. So, and it is expensive, even if it's fake. It is expensive, and what to do with it? I don't know. The big problem with melatonin. However, melatonin with combination vitamin C is also antioxidant in low concentration, also helps to grow hair. So there were clinical trials, and it is improved. The baldness was suppressed, even reversed. but it was mostly used with some nanoparticles to deliver this vitamin C, because vitamin C cannot get through the membranes of cells, so you have to use DHA, this ascorbic acid oxidized, or to make it some lipophilic, to make it so in some carriers in nanoparticles. Okay, aerobic exercise. Research has shown that regular endurance aerobic exercise can lead to improvement in vascular function, elasticity, and bioactivity of nitric elasticity of the blood vessels, and the bioavailability of nitric oxide, which is was a dilator that helps to improve blood flow and reduce arterial stiffness in humans. So it is very recommended for aging, to reverse aging, but also it helps in this prostate enlargement and hair growth. Long-term endurance training can reduce blood pressure and improve vascular elasticity, so you can read it. The research in sedentary humans, arterial stiffness is in the central cardiothoracic circulation increases with advancing age, even in healthy men and women. This suggests that regular endurance exercise may help to slow the aging process of the vascular system and reduce the risk of age-related diseases such as this baldness and prostate enlargement in men. Swimming also very attractive form of aerobic exercise because it's easy and expensive and isotonic, so I also swim quite regular. So it is some exercise is recommended, and people claim that it helps to reduce prostate. I don't know. But again, instead of this exercise, I just do cycling or swimming, more easy. So controversial method of rejuvenation. There is not much research on this, so it is again, it's my opinion mostly. So senescent cells and tumor cells rely mostly on glycolysis in the cytoplasm to convert large amount of glucose into lactate for energy production. This so-called Warburg effect. It's discovered in 1920s. Oral intake of vitamin C increases its concentration in the blood. When ascorbic acid is getting oxidized to dihydroscopic acid, DHA. DHA can compete with glucose for entry into the cell because DHA is hydrophilic, so it can get through the membrane. But it is getting through the membrane through glucose transporters in the cell membrane. Inside the cell, DHA reacts with antioxidant glutathione and quickly gets converted into ascorbate. This process reduces the concentration of cytosolic antioxidant and may lead to oxidative stress in cells due to high amounts of reactive oxygen species. But malignant cells are more sensitive to oxidative stress than normal body cells. Also, high concentration of reactive oxygen species deplete NAD+. This is a critical factor for glycolysis and energy production in the cytoplasm of malignant cells or any cells, but especially malignant cells, and can ignite an energy crisis due to decreased ATP production. So you see DHA is getting through this glucose transport, and inside the cell it is converted to vitamin C, so it works as antioxidant, but it is depleting level of glutathione. So it is actually in malignant cells the level of glutathione already low. So then it is high concentration of reactive oxygen species is may kill the malignant cells, including senescent cells, tumor cells, because what is happening, DNA damage by reactive oxygen species, and mitochondrial or membranes are damaged, so it is really working quite well. So in recent years, results from preclinical reports suggest that oral megadose of vitamin C and especially intravenous injections of ascorbates could be effectively used in management of various tumor types. While vitamin C in low doses works as antioxidant, high blood concentration of vitamin C acts as a pro-oxidant, so mechanism I explained just now. On low carbohydrate, this carnivore and ketogenic diets, oral mega doses of vitamin C above half gram per kilo, it is quite a lot. Of body weight, it is like, I'm 70 kilos, so I'm supposed to take 35 gram of ascorbic acid daily. So it's quite a lot. So, but this high concentration may block the entrance of glucose to the malicious cells and to effectively, selectively kill tumor cells and senescent cells, while healthy cells are not impacted. However, if a person is consuming carbohydrates as the main source of energy, the high blood concentration of glucose effectively outcompetes DHA for transport. Okay, so for all the men who are following on low carbohydrate diet, is the paramount importance to slow down aging and suppress development of these problems. Okay, so again, there is no alternative to carnivore diet. But even then, it is not enough. It is not enough. Okay. So I will talk. I talk already many times. So it is the carnivore diet has to be modified to extend the longevity. Otherwise, it just doesn't work. It improves health, but not the longevity. Aging is associated with endothelium dysfunction in healthy men years before the age-related decline in women. This is why women live longer. So vitamin C has been shown to enhance endothelium function and synthesis of this of these cells, and also nitric oxide production. Acute and chronic supplementation of vitamin C may increase the elasticity of large arteries and blood flow, ignite angiogenesis, so it is growth of new blood vessels, and production of nitric oxide, which is a potent vascular dilator. Meanwhile, the mainstream recommendation for ascorbic acid only 90 milligram for men, 75 milligram for women, while the tolerable upper intake level is 2 grams per day. And higher doses may lead to side effects like stomach upset, osmotic diarrhea, and flatulence. Again, I don't consider this as side effects. It presents some problem, but not critical really. So reduced gastric acidity and lower digestive enzyme levels in all the adults can lead to undigested protein, which can be fermented by colon bacteria into harmful byproducts like ammonia and toxins. Okay, so this is a problem. This is a problem why this carnivore diet with a lot of protein is not extending longevity, but actually make it shorter. So vitamin C it is again very good to produce nitric oxide, especially maybe combined with some amino acids, and again it recovers also the endothelium layer in blood vessels and capillaries, special capillaries. So and this process contributes to lower gut transit time. It is the acidity of ascorbic acid, which gets to the colon. And, so this undigested protein contributes to slower gut transit time and negatively impacts gut health, but not only gut, all toxins are getting to your blood, and then you have big problem, inflammation in all your body. Mega doses of ascorbic acid can shorten gut transit time by causing asthmatic diarrhea, and as excess of unabsorbed ascorbic acid draws water into the intestine, leading to loose stools. Resistant starch, such as raw potato starch, can be consumed to improve gut health also, because it acts as prebiotic fiber, which that feeds beneficial gut bacteria, and as this bacteria fermented in the colon, they produce short-chain fatty acids like butyrate, butyric acid, which is critical for gut cell health and help to promote healthier gut microbiome and shorten the gut transit time. And again, it is very, very recommended to use resistant starch. Recommended doses of resistant starch in the range of 25-50 grams. Nothing will happen if it will be 100 grams. Chitin in mushrooms are also working as prebiotic, and additionally, spermidine in mushrooms helps to ignite autophagy during fasting if you are on ketogenic or carnivore diet. If it on standard diet, it's no help. Ascorbic acid can suppress the digestion of raw potato starch in this absorption of the glucose, which is produced from the digestion of starch. And also high amylose maize starch can be digestion can be suppressed in the small intestine by inhibiting the enzyme pancreatic alpha amylase in a dose-dependent manner. Okay, so again, normal concentration of normally potato starch have something about 60, maybe 55-60% of resistant starch, which is getting to the colon, but the rest is digested and with production of glucose. So to avoid this production of glucose, you can combine it with high doses of ascorbic acid. Then it just mostly goes up to 80, maybe 80% is not digested and go to the colon, where it will improve gut health. When raw starch is taken with high doses of ascorbic acid, we may expect some improvement in gut health due to the production of beneficial short-chain fatty acids like butyrate and shorter gut transit time. Again, you have this, it works so that it is shortened the gut transit time. So people on strict carnivore diet, they report that they gut transit time maybe 6 days. It is awful. It is awful. It's again, it is not normal. Normally, even on a standard diet, it is 2-3 days the gut transit time. But with ascorbic acid, with mega doses of ascorbic acid, it can be 12 hours. So of course, gases are produced like hydrogen and methane, but it's not. It is not sinking. It is okay. I mean. It can be some problem for people like at night if you take this ascorbic acid at night or morning, but again, it is not so disturbing actually, I believe. The side effects can include bloating and osmotic diarrhea, as I said. Butyrate produced in the colon maintains gut barrier integrity, can improve health of the endothelium in blood vessels, so it goes to the blood, also contributes to improvement of the endothelium in the blood vessels, but protecting them from damage, reducing inflammation, and promoting the production of nitric oxide, and that helps dilate blood vessels and improve blood flow. So again, it is quite good, quite recommended. Again, people on a strict carnivore diet, they don't consume any resistant starch or any fibers. But again, you have to be careful about fibers which are like cellulose. Cellulose is cannot be fermented in the gut, but resistant starch can, and chitin from mushrooms also can be digested by beneficial bacteria with all benefits for your health. Dr. Linus Pauling recommended intakes of at least 6 grams or even 18 grams of ascorbic acid daily as a powder, not in pills, in powder, combined with 3 to 6 grams of lysine to prevent the development of atherosclerotic plaque depositions and calcification of the aorta. It works, yeah. And the effect of the Pauling therapy is much more pronounced on the diet without carbohydrates. Unfortunately, Linus Pauling himself not following the carnivore diet. His doctor recommended to follow a vegetarian diet, and then this is why he lived not longer than 100 years, 97 years. At the age of 97 years, he passed away. So you see, even such a brilliant person maybe didn't understand quite well the biology. So mega doses of ascorbic acid can be combined with the supplement of the mineral magnesium. I take magnesium chloride. So it is magnesium should be 5 gram, 1.5 gram. So it is when it is magnesium chloride, it is maybe up to 5 gram. The excess is it only helps. So then you can use amino acid taurine, arginine, And carnitine also in amount up to 3 grams. And vitamin B3. Vitamin B3 I consume nicotinic acid because it helps to detox your body. The publication, like this publication, tentatively explains the therapeutic effect of ascorbate and lysine supplementation by reducing the thickness of oxidized low-density lipoprotein that contains oxidized polyunsaturated fatty acid. This is the cause of the. You have to avoid any vegetable oils which have this high polyunsaturated fatty acids. Avoid them at any cost. But even if you avoid, there are some toxins which has to be removed, and ascorbic acid it helps, and lysine also helps to improve your health. So this is Linus Pauling. He got Nobel Prize 2 times, but one time for his contribution to quantum chemistry, and another time for his contribution to the peace movement. Following a strict carnivore diet is not extending the longevity of men and not suppressing this baldness and the hair, losing hair and the enlarged prostate. Unfortunately not. Some carnivore influencers suffer from losing hair already at the age below 60. Therefore, the modified carnivore diet, this is what I propose. And it is healthy, it is easy, and it's cheap. So the modified carnivore diet is proposed by me with the use of mega doses of ascorbic acid with resistant starch as a mild laxative and prebiotic. Also amino acids and easily digestible animal proteins such as whey protein, but also meat, animal meat cooked with sauce vide technology. The regular use of senolytics such as fisetin is necessary to eliminate senescent cells. Fisetin is good because it works especially good for prostate gland. But other senolytics can be used also. Combining oral intake of fisetin with ascorbic acid or ascorbates and with magnesium can enhance the senolytic and anti-inflammatory effects of fisetin. Also, topical treatment of the scalp, skin, regular aerobic exercise, detoxing of the body with sauna and nicotinic acid may help to slow down aging and suppress development of the baldness and enlarged prostate. So, okay, you see, this is the influences of the carnivore diet, and some in age below 50, like this Brian Johnson, for example, he's losing hair already, he's 46 years old, look terrible, to my opinion, sorry. But okay, even other people, I'm 68, and some influencers are 10 years younger, but they have no hair already, lost hair. And the Professor Bart Kay, 53 years old, he is completely bald. So again, you see it is not so easy, and the following carnivore diet, strict carnivore diet is maybe make you strong, muscles grow, but it is not extended lifespan. My priority is to increase longevity, so I modify this carnivore diet and I don't eat only meat, but I eat meat, sure, but in combination with mild laxative like ascorbic acid in mega doses, and then with this potato starch or cassava starch, it is shorten make the gut transit time shorter, and maybe 12 hours. I believe I estimate that gut transit time in like 12 hours, no, a little bit longer, but shorter than 1 day for sure. And this keeps me more healthy, and I believe that eventually this is very important. But senolytics also important. The use of senolytics and detoxing procedures are important to extend longevity. So you can go to the references, quite a lot of references, make your own research. My opinion, again, may agree, may not agree with official recommendations, mostly not. So I don't recommend you, I just explain what I am doing, and so it's up to you to make your own research, to follow recommendations, official recommendations, or what I propose. I believe that I get a solution to this. It works for me. No, it takes time, you know, it takes time. Even hair gets returns the color, which I was blonde previously, not now. But also, I treat the hair, not treat the bird, the hair on the face, facial hair. So facial hair is white, but hair on scalp is recovering. I mean, at least pigmentation is recovering. So, thank you for your time. Please support my research, and you will get, if you support my research financially, you will get access to more information, and also can ask questions. If you ask questions in the comments, normally I reply. Okay. Have a good time. Ciao, ciao.